we often hear how important sleep is to our overall health. Well, now the American Heart Association has taken it one step further.
Yeah, they sure have. The organization added sleep to its list of essential ways to stay heart healthy. Cardiovascular disease is the #1 cause of death in the U.S. And studies say 80% of all cardiovascular events can be prevented with a healthy lifestyle and also by managing your risk factors.
All right, so joining us now to help everyone get a better night's rest to improve our heart health is Dr. William Prebu, a cardiologist at New York Presbyterian. First of all, thank you for joining us.
Thank you so much for having me.
Okay, so the American Heart Association has an actual health checklist called the Essential 8. Sleep is now part of that. What else is on that list?
Oh boy, we're starting right off the bat with a quiz. Let's see how I do. A lot of the things we can do, I think we can control ourselves. Those include things like eating better, being more active, exercising maybe 30 minutes a day, avoiding tobacco products, and managing our weight. And then the other 3 parts, in addition to sleep of a healthy heart, include managing our cholesterol with the help of a physician, managing blood sugar, and managing our blood pressures.
So let me ask you a question. What is the link? Are you surprised it's taken this long to put sleep on the list there? And then also, what is the link between sleep and heart health?
Yeah, I think it is a little bit surprising that it took this much time, but there's more data and newer data that's helping us understand that sleeping is really important. Getting a good night's sleep is a huge part of a heart healthy lifestyle. And all of these things kind of go together. If we can exercise, a lot of patients will come to us and say, I'm having trouble sleeping and having trouble getting enough good quality sleep, and eating better and being active during the day can help us get that sleep. So they kind of go hand in hand.
Okay, so doctor, what is the recommended amount of sleep for adults that they should essentially be getting, and is it different for children?
Well, last night was the Super Bowl. We have 4 kids at home who I hope are watching after school. And they did not get enough sleep last night because they're supposed to get about 12 hours. For adults, it's usually recommended 8 hours of sleep, which is the old adage that we typically have.
So does 8 still apply for adults? Because remember, didn't it go down? Didn't it go like to 6 and then it went back up to 8? So 8 is what it is.
Yeah, I think every person, first of all, is a little bit different. Different people have different needs, but 8 is a very good ballpark number. And this idea that 6 hours is enough sleep is probably from people who are working too hard, which I know quite a few of. So
maybe I was just lying to myself. So how's your heart at risk then if you don't get enough sleep?
Well, unfortunately, it puts increased stress on your heart. The most common time to have a heart attack or a stroke is around 3 a.m. to 5 a.m.
Oh, wow.
And when we don't have good sleep patterns, we're putting more stress on our heart during these time frames, and that can really contribute to heart attacks and strokes, which we obviously want to avoid.
So, doctor, is there any way to kind of reverse years of having poor sleep habits?
Absolutely. It's never too late to start. Whether we're in our 20s, 40s, 60s, or even 80s, new heart healthy habits are always beneficial. And really, you can, I don't know if reverse is the right word, but you can really take a step forward in preventing adverse cardiac events by getting in heart healthy habits as soon as you can.
All right.
Well, doctor, thank you so much. I know we're hearing more and more about how important sleep is, so it's nice to be able to put it in perspective, especially knowing the number of hours and how it puts us at risk. Thanks for being with us this afternoon.
Thank you so much.